Anterior, middle, superior alveolar nerve block is indicated for pain management from central incisors to premolars, palatal tissue from midline to molars, minus the lip. Intraoral landmarks include the midline palatine suture and the premolars. It is helpful for the clinician to probe the soft tissue from a perpendicular standpoint to identify a spongy location that can accommodate a larger portion of local anesthetic. The palatal bone is porous and has nutrient canals, which allow for diffusion to the dental plexus. The video demonstrates the clinician finding an appropriate location on both right and left sides. This location could vary based on the patient's tissue, palatal vault, and spongy location, somewhere between the gingival margin of the premolars and the midline palatine suture. Once the clinician has applied pressure anesthesia, uncapped the syringe, and achieves stability, the Q-tip can be rolled or slid out of the way to identify and penetrate the tissue at the appropriate location. It is best to keep pressure on the palate near the penetration location until blanching is seen. You will also note that due to this injection taking 3 minutes if a 2% solution is used, or 1.5 minutes if a 4% solution is used, some stability options are demonstrated, including the chin, or once blanching is observed, flipping the Q-tip and supporting the syringe with a non-dominant hand. A wide area of blanching will be seen during the deposition of this injection. Technique options for palatal anesthesia. The gate control theory suggests a two-stage technique is helpful for pain management. One option is pressure anesthesia used for 1 minute following 1 minute of topical application. The clinician should maintain pressure near the injection site until penetration of the needle and initial blanching. A second option would be pre-puncture technique, where the bevel of the needle is pressed over the tissue at a 45-degree angle and a small amount of local anesthetic solution is deposited. A third option is the drop technique. The clinician will enter the tissue at approximately 1 to 2 millimeters of depth, apply 1 to 2 drops following a single aspiration, and wait 1 to 2 minutes before administering the bulk of the dose. Extended verbals for the anterior middle superior alveolar nerve block. Medical history has been reviewed and there are no changes. Vitals are stable and within normal limits. No contraindications for local anesthesia. I will be using 20% benzocaine topical for 1 to 2 minutes and 2% lidocaine with 1 to 100,000 epinephrine with an expiration date of January 2018. I will also be using a 27 gauge short needle. The injection is the anterior middle superior alveolar nerve block. This anesthetizes the pulpal of the central incisor through the premolars in one quadrant, as well as the buccal soft tissue of the affected teeth, and the soft tissue of the palate from the central incisors to the molar, minus the patient's labial tissue. The insertion site is the spongy area halfway between the gingival margin of the premolars and the palatine raphe. The depth of penetration is approximately 3 to 6 millimeters. The deposit site is the junction of the vertical and horizontal aspects of the palate. Landmarks will include the midway location, approximately between the gingival margin and the midline palatine suture. Pathway will include the bevel of the needle at 60 degrees to the bone between the gingival margin and the midline suture, between the first and second premolars, at the spongy area that will accommodate the dose. Bevel is not critical. The dose range for a 4% solution would be 0.9 milliliters over a 1.5 minute deposition. For a 2% solution, it will be 1.7 milliliters over a 3-minute deposition. Complications include edema, pain at the site, and possibly ischemia. During the injection, it is important to communicate with patients and give them positive feedback. Also with faculty, to state when you have reached your landmark. To also state when you are aspirating and the results of the aspiration twice, as well as letting the faculty know when you are ready to deposit the solution. Extended blanching will be seen with this injection.